Hi, Dr. Delacruz here. Today in this video, I'll be going through some of the reasons why you might be having toothache and to kind of help you diagnose them. Again, these videos is just instructional to help you and kind of give you an idea what might be going on. But I do urge you to go see your dental professionals to be properly diagnosed. So when it comes to tooth pain, there are 7 reasons why you might have tooth pain. And this is part of how we as dentists kind of diagnose what you may have. And I will kind of go through this and give you kind of the common symptoms and what you can do to help with pain. So listen to this part carefully, just because not every tooth pain or toothache is similar. They have different presentations, and based on what you may have, certain remedies may make that worse. Certain remedies may make that better. So the first one is dental pulpitis. This is the most commonly known as toothache. First thing you want to do is kind of look in the mouth and see if that tooth or that area where you have pain, if the tooth is broken down or if there's major holes in them. If that's the case, that's going to fall into the next category. But this first one is dental pulpitis or toothache. So when you look in there, you can't see a hole, okay? So the more common symptoms that you will kind of have is sharp pain, a dull ache, throbbing. Sometimes people have burning sensation, throbbing. And for some people, it's consistent and getting worse. And some people, it's kind of intermittent and comes and goes. All those things will kind of give us as dentists an idea of what might be going on, if this is reversible or not, okay? The more common triggers for these are cold, physical stimulus, so if you bite down on something or if you're pushing on it, and sweets. Okay, so your common remedies for this is, as I mentioned before, NSAIDs and Tylenol. If you take them both together, they do help a lot better than by themselves. But if you had to choose, pick the NSAID or the ibuprofen. Next one is warm salt water rinses. Remember, don't make it cold. Okay, cold compresses. And the last one is kind of a toothpaste trick I recommend to my patient. Brush the toothpaste in and floss it between the tooth that's hurting you and leave it there for about 5 to 10 minutes. And then you can go back and rinse it and take it off. But I find that toothpaste with fluoride tend to kind of soak in and help soothe the tooth and help you get out of pain. For reason number 2 why you might have tooth pain. This one is exposed cementum and dentin. This can happen in many different ways. If you're grinding your teeth and you wear through the enamel, if you've cracked the tooth and a portion of the enamel is missing and the dentin is exposed, and the last part is if you have any kind of gum recession or bone recession where you can see a portion of your root. That is covered by cementum, okay? And typically that's not exposed in the mouth. So if that is exposed, you might be having some sensitivity. Again, NSAIDs will help, Tylenol will help, and I like my toothpaste trick where you brush the toothpaste in, let it sit for about 5 or 10 minutes, and then rinse it off. And usually it's not immediate, but over several days to a few weeks, it can make a tremendous difference. Okay, the third one is fractured or cracked tooth. Now, I kind of mentioned in number 2 that where you have cracked a tooth, but when I talk about fractured or cracked tooth, this is a crack that kind of goes down the tooth. Now, your tooth composes of a crown and a root below it. Okay, think of it as an iceberg. What you see above the water is the crown portion. What's the larger part is below the water, which is the root portion. So when you have a crack, that crack may just be located in the top portion of the tooth. And in worst cases, if that crack goes all the way through the tooth and into the root themselves. So typically what triggers this is biting and chewing. Okay, obviously stay away from biting and chewing. If you can stick with liquid diet, the better. But this, you can use Tylenol, ibuprofen to help with pain, warm salt water rinses, but this is very temporary. You definitely want to get this looked at and diagnosed properly so that it can be properly treated. In some case, it can be saved. In some case, they cannot, and they have to be removed. Number 4, It's called pericornitis. Basically, this is kind of associated with your wisdom teeth. So your wisdom teeth, for most of us, do not have room in the mouth for that third molar. And typically your tissue will cover it to a certain degree. And when it's covered, food and bacteria still gets underneath that piece of tissue that's covering the tooth, and when you can't get in there and clean it properly, it does lead to localized inflammation. Sometimes it can pus, sometimes it can have drainage with it, and the tissue, as it inflames the tooth above it, if you have a wisdom tooth above it or the second molar back there, it can also end up biting on that section and cause more pain. So the more common remedies that I recommend for that is ibuprofen, typically, so an NSAID. Rinse the area kind of vigorously with salt water, or if you have a little syringe, or if you even have like a water flosser. Waterpick is a brand, but you can use it to irrigate underneath the in and around the tissue to kind of get the debris out of there. The more the debris is out of there, the less bacteria is with it, and you will have less inflammation. Number 5, it's called alveolar osteitis. This is more commonly known as dry socket. So this happens when you've had a tooth removed and that socket where the tooth was removed is empty. So typically what happens, it will fill up with blood, that blood will clot, and over time, usually 7 to 10 days, that will start to form into tissue, okay, which is going to create the initial plug so that there's nothing getting in the hole. What dry socket is if that blood clot comes out before that really starts to turn into tissue, and that's where you're going to have most of your problems, okay? There's many reasons why you get a dry socket. Some of the more common ones are drinking through a straw, smoking, eating, cramming foods in there, physical activity. So your dentist will typically give you some recommendations on how to avoid that. But when it comes to dry sockets, when the blood clot comes out of there, that is an empty space. Typically what happens is food gets into the hole and then bacteria will follow. And that bacteria will obviously eat the food. They will create toxins and they induce inflammation, and that is where your pain is coming from. Okay, when it comes to dry socket, there are several remedies that you can do. You can go back to your dentist, and typically they will either irrigate it and put some medication in there called dry socket paste or other medicaments which will help with pain. In some cases, they will open that site up, clean it out, scrape the inside and get it to re-bleed so that it will fill up with blood again, and that will turn into a blood clot, and there's your seal. But the problem with that is it's like starting surgery day one. There is still a high chance that you could get a dry socket, and so you would still be in pain. Typically what I recommend is, if you do experience dry socket, to write it out. Typically after about 2 to 3 weeks, it will return to normal. Yes, it does suck, but it will get better. But what you can do to help with that, if you do would end up with dry socket, is to clean the socket out. So you can use warm salt water rinses, gently rinse it. You can also get a monojet syringe, which is basically a little syringe you can get from your dentist. You can also get it over the counter. You can put salt water in it and gently rinse inside the hole to get any food and debris out of there. That will help. You can also use medicated rinses like chlorhexidine that you can get from your dentist, prescribed to you. But really the big goal is to keep stuff out of that hole. Over time, that will form a tissue inside, which is going to kind of block some of the pain or discomfort. And over time, that will be turned into tissue, and it will eventually turn into bone over time. And that's how dry sockets are cured. Number 6, maxillary sinusitis mimicking toothache. Yes, that's a big one. But your teeth here in the upper, they are really close, especially your premolars and molars. The roots are right up against the sinus. And so if you have any pressure in the sinuses from a sinus infection, that can create pressure on the root tips, and it can give you generalized toothache or pain at that time. What are the common signs for this? Well, typically that pain will increase if you're laying down or if you're bending over. You'll get the sensation of fullness to that side. And it's usually unilateral, or one side or the other. Okay, typically it's not on both sides. And then you will also have this feeling of being unwell or feverish. Again, you got to keep in mind that you have a sinus infection. Infection can lead to fever, so fever is kind of a key there. And then the other one is it can also mimic jaw pain or TMJ disorders. That could be just an ache, a throb kind of right behind the ear and down your jaw there. So all these things you kind of want to get an idea if you may be having a sinus infection versus an actual toothache. Now, what you can do is some localized and systemic medication to kind of help with this or help you kind of diagnose. So you can use nasal spray, nasal lavages, or nasal rinses to kind of clear up the sinuses. You can also take an over-the-counter that can help you with decongestion. If these things are helping, then typically it's a sinus issue. And if those are not helping, what you can do is get antibiotics from your physician, only if you have eliminated all dental possibilities. Okay. Once you have ruled out the dental issues and you're still having that sensation, likely you may be having a sinus infection. So you can either get that antibiotic from your physician or your dentist. Final word of advice: please see your dentist for proper diagnosis and treatment. These suggestions I gave you today are temporary. Even if it helps, please go see your dentist, because that pain can return. And in some cases, I've seen pain get even worse. Okay. You definitely do not want to leave. If it is an infection, you do not want to leave there, because it can have a lot of negative oral and systemic problems down the road. If you like this video and the tips I've included, please consider subscribing and sharing it to others or friends that you may have that might be dealing with toothache today. Thank you.